the students when I started teaching, and I'm thankful that I can teach. Thank you, good God above, for blessing me always. All right. And next is this slide. Now, this slide talks about some important names of orthopedics, right? If you happen to write your FMG exam, this is an MCQ. Orthopedics means straight child. And the man who coined it is also called as the Papa of orthopedics, Nicholas Andre, right? So this is the number one father. If this name is not there, the second name is Thomas. Thomas, who gave a splint for tuberculosis of knee, TB knee, and who made a test, Thomas test, for flexion deformities of the hip joint. Is Thomas Splint an MCQ? True. Is Thomas test an MCQ? True. Is Thomas test the most important thing on this page? True. All right. Then we have Robert Jones, who is nephew of Thomas, who is the father of modern orthopedics. And then we have Charles, who is the father of arthroplasty, means replacement. Joint replacement. So here comes my first question, my friends. Name the most common joint replaced in the human body. Knee joint. Beautiful. Knee is something that the examiners love, and knee is the most common joint asked, right? Which is replaced in the human body. It is also the largest joint in the human body. Are we good? So interesting hua. I wanted to have a haircut yesterday for you guys to look very fresh for this class. And while getting a haircut, I had a sleep. And when I got up, this is how I looked. So my apologies for the man who did this to me. And I'm really sorry that people are looking at where is Dr. Apoor Mehra. So this was what happens when you have an orthopedic surgeon who starts operating 5:30 in the morning and he goes for a haircut at 7. So I don't know. Kindly forgive the guy who gave me this this haircut. I can't. Kartika, I am talking about the haircut. Iski speed कैसे बढ़ाऊं बेटा? Okay. So please, I am young boss. I am absolutely young Faisal. What do you mean? Right. Right. So when we look at orthopedics, right, X-rays are usually the first investigation for orthopedics. So we get the X-rays first. That is the number one thing to be done. All right. And they can show you everything. It can show you the bone. It can show you the cortex of the bone, the outer side, right? It can show you the marrow. Marrow is very important. We know that why? Because all the diseases are in marrow. All right. So bolo, diseases are in marrow. And we will apply our cerebellum to identify the MCQ's answer. Okay. So this is important. Then we have the diaphysis of the bone, right? And then it can show you the epiphysis, the end of a bone, the metaphysis of the bone, and the growth plate, also called the epiphyseal plate, which is responsible for the growth of the bone, right? Is called as a cartilage. They are cartilage. So cartilage X-ray पे नहीं दिखता. तो X-ray पे bone दिखती है. X-rays पे cortex और marrow दिखता है. X-ray cannot show you the cartilage. Also, X-rays can show you the soft tissue layers. Okay, so cartilage कहाँ दिखता है बेटा? Anybody who can tell me where do you see cartilage? MRI, beautiful. Cartilage is picked up on MRI. We will talk about the next best investigation after X-rays in orthopedic. That happens to be the MRI. Also, just a quick revision. Tell me the diseases which are in the epiphysis of the bone. Can you tell me 2 tumors which are epiphyseal? Right. ECG. Chondroblastoma and giant cell tumor. Name the diseases which are in the metaphysis: osteomyelitis and one more. OM is osteomyelitis and osteosarcoma, right? And name, what do you see in diaphysis? You just had lecture by Zainab ma'am. Vowels, vowels, vowels. So adamantinoma, osteoid osteoma. It's a cortical lesion. It's in the cortex. And Ewing's sarcoma. So these are the lesions which are seen in the diaphysis. Okay, that's all. When you look at the bone, when bone has got 65% component made of inorganic things like calcium hydroxyapatite, and they can ask you this question: what is the component or the mechanical formula? So calcium is chemical formula Ca10PO46OH2 minus is calcium hydroxyapatite, and 35% is organic. And here comes the collagen which forms the bone, type 1 collagen. So 1. Type 1 collagen is in bone. So which collagen is in cartilage? Type 2 collagen. Okay, are we good? So this is something we should remember. All right. When we look at now another question which is very common in INI-CT exam which you will have in May next year, next month. All right. So when I look at the age at which the epiphysis futures with the metaphysis and the physis or the growth plate disappears. So here, if you look here carefully, epiphysis fuses with the metaphysis and the physis disappears. This is the age of skeletal maturity. So you need to remember age of skeletal maturity. 18 is shoulder, elbow is 16, wrist is 18. 18, 16, 18. Alternate 18, 16, 18. So knee joint is again 18. All right. So hip and ankle is 16, 18, 16. So we alternate. कहते हैं गांव में जब बच्चे बड़े होते हैं तो माँ बाप कहते हैं अपने कंधों पे घर का बोझ उठाओ, अपने घुटनों पर खड़े हो जाओ. So shoulder and knee is 18. So 18, 16, 18. So lower limb is 16, 18, 16. So you have to alternate. And remember one thing, they usually ask you these two. Knee and wrist. They are 18, That's your question that's coming nowadays. You want to prove that it's an 18-year-old individual, not 16. What X-ray will you do? Knee and wrist can prove, right? This is an 18-year-old individual. Are we good? This is called the milking position of human beings. Are we good with the speed on which I'm going? Are we okay with it? Comfortable in the language in which I'm teaching, my friends? Called hand. Epiphysis, again, this question came in the image, this an image. If you have a joint forming epiphysis, it will be covered with the cartilage. It's called as the pressure epiphysis. Right, the head of femur, the head of humerus, or the lower end of fibula or tibia, that came into this exam. Right, that's a pressure epiphysis, joint forming epiphysis. And then next to it, right, next to it is the traction epiphysis, the pull of a muscle like trochanters and tuberosities. And this is what is the mnemonic for rotator cuff muscle. Supraspinatus, infraspinatus, teres minor, small t, then subscapularis. This goes on lesser tuberosity, and this goes on greater tuberosity of humerus. These are called as the rotator cuff muscles. So these are all, they are important muscles. So what goes on the greater trochanter? Anybody? Gluteus medius and gluteus minimus. What goes on the lesser trochanter? Iliopsoas. All right. So this is something that comes with the question. And then you have, these are the two important epiphyses. The third epiphysis is called as atavistic epiphysis. In human beings, it is right fused to a bone. In animal kingdom, it's separate one, like coracoid process of scapula. And then you have aberrant epiphysis. किसी में होगा, किसी में नहीं होगा, तो हमें exam में नहीं पढ़ना. Aberrant epiphysis, we are not supposed to know. All right. Epiphysis injuries. They are classified by, what is the name here? S. Tell me the full form of this classification. Salter Harris classification for epiphyseal injuries in children. Because after skeletal maturity, the epiphyseal injuries can't occur. So type 1 injury is when there is a slip of epiphysis, type 1. Type 2 is slip with a metaphyseal part. Type 3 is a split of epiphysis. Type 4 is a split with a metaphyseal part. And type 5 is crushing of the physis. 5 is 5. 5 is 5, the growth plate. All right. So 5 is 5. So crushing of the physis. This is what the epiphyseal injuries are. And 1 to 5, 5 is the worst. And when the physis is crushed, the growth disturbances occur. This question came this time. The growth plate or epiphyseal plate is injured. There will be growth disturbances, right? So this is called as type 2 is the most common. It's called as the Thurston-Holland sign. Thurston-Holland sign. All right. Thurston-Holland sign. All right. Right. So we can go ahead now. When I look at, this is what I told you, X-rays, right? Can show you the cortex. Break in the cortex is called as a fracture. I told you marrow is the disease area. These are the muscle layers, the fascia, and the fat layer. All right. So when you have increased compartment pressure, you need to release the fascia called as fasciotomy. All right. So example of different type of Saltaire is आपको required नहीं है अरोड़ा साहब नहीं चाहिए. All right. So these are called as the soft tissue planes, and there comes break in the cortex is fracture. Osteomyelitis, that is infection of the bone, right? There is loss of soft tissue planes after 24 hours osteomyelitis. First 24 hours in infections, X-rays are normal. In osteomyelitis, in first 24 hours, X-rays are normal. Beyond 24 hours, loss of soft tissue, right, is loss of soft tissue. So Ronak, most common place of compartment syndrome is lower limb. We will talk about it when we come to trauma. Earlier than the periosteal reaction, which comes on day 7 to 10. So periosteal reactions in infection, right, comes on day 7 to 10. And infections in the knee joint, in the spine, there are curvatures of the spine. Cervical spine goes in. So there is cervical lordosis. Thoracic comes out. Thoracic kyphosis. Lumbar lordosis. All right. So these are the curvatures of the spine. So when there is infection of spine, one of the infection of spine is tuberculosis, there will be loss of curvature of the spine. All right. Which is seen earlier than the reduced disk space in tuberculosis. This is a question that again comes to you. And I told you joint space is cartilage, not seen on X-ray, and reduced joint space means arthritis. So here you can see the joint space, normal joint space, reduced joint space. All right. When the distal part goes towards the midline, it's called as a varus. Varus. Genu means bend, means knee joint. All right. So in varus, when both the knees they turn into varus, इनके बीच में हम O लिख सकते हैं, called as osteoarthritis. जब हम इनके बीच में R लिख सकते हैं, it's called as rheumatoid arthritis. So arthritis, RA will have valgus, OA will have varus. All right, OA will have valgus, OA will have varus, RA will have valgus. This is extremely important. Are we good? This is an important slide. Are we good? What's this? What's this? The dot. Patella. याद रखना, it's patella. In fact, AP view में patella का fracture दिखाया था. There was a fracture shown in the AP view. You had to pick up. We will see this question over the next 2 days. All right. Now comes the important X-rays of upper limb. Right. The highest bony landmark on AP view is on the shoulder is clavicle, and just beneath the clavicle is atavistic epiphysis called as coracoid. The head of the humerus is 4 times the glenoid. 4:1 is the ratio. That's why it's the most common joint to dislocate. All right. Around the elbow. All right. If you look around the elbow, you have capitulum, the first one to come, then comes the radial head. Remember the lateral part of trochlea. The trochlea has medial part and the lateral part. The lateral part of trochlea, lateral part, when it gets damaged? Anybody? If the lateral part of trochlea gets damaged, if the lateral part of trochlea gets damaged, it causes a deformity. The lower end of humerus looks like the tail of a fish. Fish tail deformity. All right, fish tail deformity. So when there's a lower end of humerus or उसका blood supply खराब हो जाए and the lateral part of trochlea is damaged, it causes fish tail deformity. All right, fish tail deformity. Nowadays they are asking you this deformity. Okay, key point. Are we good? Right. What is this bone, my friends? Scaphoid. Remember scaphoid, the most common carpal bone to get fractured. Okay. What is this bone, my friends? छा गए यार, बढ़िया है. I'm so happy with this batch. This is lunate. And remember one thing on the lateral view of the wrist joint, which is the bone which is anterior? First metacarpal. So if you look at the lateral view, thumb is anterior. Remember. So if there is a fracture and the bone goes towards the thumb, it means anterior displacement, opposite is posterior displacement. Are we good? Are we good? Right. Lowest. Sacroiliitis is a feature of a condition in a young man, low backache, reduced chest expansion, HLA-B27 positive. What is the disease? What is the disease? Ankylosing spondylitis. Brilliant. Middle-aged female, bilateral hand pain, morning stiffness. Middle-aged female, bilateral hand pain, morning stiffness. Rheumatoid arthritis. Will rheumatoid arthritis have genu valgum or verum? Genu valgum or verum? Valgum. Wonderful. Valgum. Will osteoarthritis have genu verum or valgum? Genu verum. Wonderful. Right? Now, this is Shenton's arch, upper end of femur and the pubic rami, the pelvis. Normal. If the pubic rami breaks, acetabulum breaks, upper end femur breaks, this is a damaged Shenton's arch. All right. This is seen in a condition called as developmental dysplasia of hip, DDH. And the disease is caused because the pathology is shallow acetabulum. For the head of femur, you need a deep acetabulum. Deep acetabulum. And when the acetabulum is shallow, the head dislocates. DDH. Right? Anybody screening tool for DDH? Screening tool for DDH? Ultrasound. Investigation of choice for DDH? MRI. In orthopedics, X-ray के बाद अगली चीज करते हैं MRI. So C for cortex, C for CT scan. If you have to see the cortex, or you need to see the calcification, CT scan. Okay? Cortex and calcification, CT scan. Remember that. Okay? Remember that. Okay? So this is MRI. The king of investigations in my subject is MRI. कुछ समझना है मार देना. मार देना तुम बच जाओगे. नहीं मारोगे तुम लग ले. Okay? So इसको मारना ताकि तुम्हारे को कोई छू ना पाए. MRI can show you the marrow where the diseases are, can show you the cartilage which is not seen on X-ray and CT scan, and also can show you the soft tissues. All right, so this is very, very important. MRI can show you the marrow, the cartilage, and the soft tissues. All right, आप लोग देखिए, I will just be back in a flash, my friends. I'm just coming. All right, so let's go ahead now. All right, so when I look at the MRIs, the sagittal view MRI of the knee joint, right? The sagittal view MRI of the knee joint, right? So the cruciate ligament, which make a cross in the knee joint, cruciate is a cross. The ACL comes anterior on the tibia. PCL goes posterior on the tibia. So ACL and PCL. All right. So ACL will prevent the tibia going anteriorly. Right. So it goes anteriorly, prevents hyperextension and internal rotation. And PCL will prevent, posterior cruciate ligament will prevent external rotation of the leg, right? External rotation, remember. All right. One more thing you need to remember is, right, that they can just show you the MRI and highlight this ACL or PCL. You have to just identify. ये भी question आया हुआ है. All right, sir. Which disease show resolving on symptoms of limping which happens due to activity after rest in a child? We will talk about it. Okay, we will talk about it. Marrow edema. All right, marrow edema. What investigation will pick up the marrow edema? MRI. So MRI can pick up the marrow edema. All right. And if you have weak bones or you have excessive stress on a bone, on a normal bone, more force, the marrow edema will be there and it is going to be called as a stress fracture. So stress fracture is a misnomer. In a fracture, the cortex breaks, but in a stress fracture, the marrow breaks. So in stress fracture, the marrow breaks. All right. And that is why it is an important investigation for orthopedicians, right? It can pick up the stress fractures. All right. Now, bone scan, B for bone scan, B for blastic activity. It can pick up, bone scan can pick up, right, osteoblastic mets, right? It can pick up the bilateral stress fractures. So B for bone scan, right? B for blastic mets, B for blastic lesions. So osteoblastic cells, wherever they are more, bone tuta repair karega, right? Fractures हुए, it will be showing an activity. All right. Metastasis hua, which is blastic metastasis. Which disease has blastic metastasis? Prostate. All right. Prostate will have a blastic metastasis. All right. So wherever it is, where it is blastic metastasis, bone scan is very good. Very, very good. And then remember PET-CT. PET-CT is an investigation which is going to pick up your metastasis better than bone scan. The only place where bone scan is better is when osteoblastic mets are there. So if you go on the right side, multiple osteoblastic mets like prostate, bone scan, multiple mets, PET scan, but single lesion MRI is the king in my subject. Stress fractures overall is MRI. Unilateral stress fractures is again MRI. Bilateral is bone scan. The whole body can be picked up. All right. Remember one more thing. They will give you a history. Patient had a marathon running, had pain in one area. All right. X-ray was normal. What will you do? MRI. What is it? Stress fracture, also called as nutcrackers or shin splint. So this is something that you should remember. March fracture is one of the stress fractures involving the metatarsal neck, second more than third. Upper limb olecranon in the spine, an area called as pars interarticularis between the articular process, superior and inferior articular process, classically L5 vertebra. All right. And the treatment for stress fractures is cast or rest to that body part. Do not wear bait. It's going to be more painful, will not allow it to heal. All right. Going further, remember in orthopedics, pain, fever, and swelling of a limb, you might think about infections, but tumors, they present like infections. So two tumors which present like osteomyelitis are Ewing sarcoma, which is a diaphyseal lesion, and osteosarcoma, right? So they mimic each other. So how will you prove what is what? Further to confuse, infections and tumors both are very common in metaphysics. So you need to take out a biopsy and differentiate it. So differentiated by the tissue diagnosis. That's why it's written here. Next investigation in orthopedics is usually MRI. But the best is always the biopsy. The gold standard is a tissue diagnosis. That's why if you have a lesion which presents like osteomyelitis or presents like tumor, always go in, take out a tissue, divide into two parts. Send one for culture sensitivity. If it's infection, organism will grow. Send second for histopathology. If it's tumor, you can see the microscopic, the cells under the microscope. All right, this we have already done. DDH, investigation of choices. MRI screening tool is ultrasound. All right. when you have to joints, joints are different. They're covered by cartilage, there's fluid inside, there are ligaments, right? Everything is there inside. They're cushions. So the first investigation is always X-ray in my subject. And MRI is a very good thing for the joints. Means, कहते हैं shoulder and knee, MRI is almost like X-rays. All right. And then if it is infection or inflammation, do an aspiration, do a synovial fluid analysis, or if it's a trauma, do an arthroscopy. Remember the mnemonic: X-mass, X-ray, MRI, aspiration, oblique arthroscopy. And remember, aspiration is done in my subject with ultrasound guidance. It is done under ultrasound guidance. It's very, very important to be specifically taking out a fluid right from the joints, my friend. So some of the periosteal reactions in orthopedics, it indicates that the bone is getting damaged and the disease is very aggressive. Sun ray appearance can be seen in any malignant lesion, any chronic process, any malignant lesion, any chronic process, but usually osteosarcoma. Similarly, a triangular piece of bone underneath the lifted up periosteum. Same, any malignant, any chronic process, but usually osteosarcoma. Multiple layers coming out in the diaphyseal lesion. Any malignant lesion or chronic process, but usually Ewing's sarcoma, called as onion peel appearance. All right. These are aggressive periosteal layers. When a single layer of periosteum is there, that's called as a solid periosteal reaction. A solid periosteal reaction or single layer of periosteal reaction is an easier thing to see, an easier thing to handle. So, right, it means that it's a less aggressive lesion. All right. So, sun ray appearance and Codman's triangle, osteosarcoma, but can be seen any malignant lesion. Onion peel appearance, Ewing sarcoma, but can be seen in any malignant or chronic lesions. Soap bubble appearance, giant cell tumor, also called as osteoclastoma, more than adamantinoma, which is in the diaphysis. Patchy calcification is cartilaginous tumors. It is a different in cartilaginous tumors. It can be rings, it can be whorls, different patterns, which is patchy calcification. And uniform calcification is more aggressive osteogenic tumor like osteosarcoma. All right. So this is what? This is patchy calcification. This is uniform calcification. And a tumor that can go till the joint is the giant. So giant cell tumor can go till the joint. So it can go till the joint. Tumors, they respect the joint, they respect the cartilage. The only tumor which can eat the cartilage, eat the joint is a giant cell tumor. It is a GCT. That is what it is. All right. So biopsy is the gold standard for tumors and infection. Multiple mets, PET scan is better than bone scan. Bone scan is better for osteoblastic mets like prostate, right? And osteomyelitis, X-ray, then MRI, but MRI will show you changes earlier. B is again chondrosarcoma, true. All right. So some questions, PYQ. Can you tell me the answer? Joint forming, very nice, brilliant, correct. It is a pressure epiphysis. Next. Osteosarcoma, correct. Next. Epiphyseal plate. All right. Now this is something I did told you. Answer. Correct. Knee and wrist. Hypertrophic zone. In the different zones of the physis, it is the hypertrophic zone which is the weakest. And that's the one which breaks in Salter-Harris classification. Correct. Also called as a maturation zone. Are you okay with the combination of the MCQs along with the important chapters? Thanks. In infections of orthopedics, Staph aureus is the most common one with metaphyseal involvement. Aapko jab bhi you choose an organism, think of Staph aureus. All right. The second common organism that you need to remember is sickle cell anemia. seen in Salmonella, and it usually involves the diaphysis. Staph will involve the metaphysis, comes with the blood, hematogenous roots. So osteomyelitis is hematogenous, metaphysis, Staph aureus. Sickle cell anemia, Salmonella is the organism. IV drug abusers, Pseudomonas. Foot, again, Pseudomonas. Open injuries, Staph aureus. Human bite, which is the most dangerous bite in the world, Eikenella. Animal bites, Pasteurella. So these are very, very important, right? So this is very, very important. And then reduce movement of a limb. Reduce movement of a limb with toxic child and tender metaphysis. All right. Reduce movement of a limb, toxic child and tender metaphysis. It's a clinical diagnosis for osteomyelitis. Osteomyelitis, the X-ray, no loss of soft tissue plane in first 24 hours. So first 24 hours, X-ray is normal. MRI will be positive. It becomes positive in 12 hours. Bone scan in 12 to 24 hours. In first 24 hours, treatment is non-operative. Just give antibiotics, right? In osteomyelitis, more than 24 hours, X-ray will show you loss of soft tissue planes. MRI and bone scan is already positive. Treatment is surgical. Whether you operate or you don't operate, duration of antibiotic stays to be the 6 weeks. Remember this rule. So your X-ray can diagnose whether you want to operate or you don't want to operate. It's very simple. Are we good? Are we good? Cool. Right. Now let's look at the deformities of the hip. That was bone, this is joints, right? If at the hip you have flexion, abduction, externation, it means maximum capacity. It means the limb is lengthened, longer. All right. So you have synovial proliferation, synovitis causing Faber. You have pus in the joint, septic arthritis, although arthritis word means damage to cartilage, but it's a misnomer. It just means pus in the joint. Or you have iliotibial band contracture seen in polio, or you have the head coming out, anterior dislocation. So this is Faber, right? Deformities of the hip. As compared to it, flexion, adduction, interrotation, Fadil is a feature of posterior dislocation of the hip and more than arthritis. So this is something which is very important. Posterior dislocation of the hip more than, right, arthritis. Okay. So remember that a hip dislocates posteriorly more commonly. All right. And that is why in Fadil, posterior dislocation पहले दिया हुआ है. Posterior dislocation पहले दिया हुआ. And there is shortening. All right. So there is shortening. Remember that. Okay. So shortening. In Fadil, there is shortening. So it is flexion, adduction, interrotation, Fadil. Right? And then Faber, lengthening. Are we good? All right. So joint, Faber at the hip, 0 to 5-year-old child. Toxic means fever. Increased erythrocyte sedimentation rate, increased C-reactive protein, absent movement of a joint, septic arthritis. One of the criteria of septic arthritis is Kocher's criteria. एक नाम दे रहा हूं आपको. To diagnose whether it's septic or not. Order of investigation, X-ray, MRI, aspiration. Treatment is always surgical. Whether it's bone or joint, 6 weeks of antibiotics are given because even joint infections come from the bone. All right, as compared to it, 6 to 12-year-old child, non-toxic, decreased movement of a limb joint. So this is again Faber, transient synovitis, temporary proliferation of synovium. Order of investigation, again X-mass, because you can't differentiate so easy between decreased movement and absent movement. It's not easy to differentiate between decreased movement and absent movement. Okay, so that is why septic arthritis and transient synovitis, the order of investigation will be X-ray, MRI, aspiration. पूरा करेंगे. Somebody asked me a question, sir, how to differentiate, right? If there's a child with a limb which gets okay, that is transient synovitis. Temporary proliferation of synovium and can disappear. Self-resolving condition. Just give rest, it's going to be okay. X-mass means X-ray, MRI, aspiration. Sunny, we did it a short while ago. Okay, so this is something you should remember. Okay, arthrotomy. Arthro means joint, tomy means opening the capsule. So opening the joint capsule is arthrotomy. All right, this is there. So Tom Smith arthritis. If there is septic arthritis, of hip in infants, the femur epiphysis is destroyed. Femur epiphysis is destroyed. Which epiphysis of femur? Capital means head epiphysis of femur is destroyed. And that is why it's called as a hypermobility joint. Tom Smith arthritis is hypermobility. All right. Then comes subacute infections of the bone. Subacute infection means they've been there for longer. They will have sclerotic margin with a lytic lesion. Sclerotic margin means good immunity. Patient's body is trying to stop it, called as Brody's abscess. Some books, they say it is chronic osteomyelitis also, but you will choose subacute over chronic. All right, seen in upper end of tibia and will have sclerotic margins. It is seen in immunocompetent host. It means you will not see it in HIV positive patients where the immunity is compromised. And when, right, Tom Smith arthritis, femur capital epiphysis digitalis. Femur capital means head. Femur capital epiphysis. This is the head of the femur epiphysis. यहाँ पे खत्म हो गया. Okay, it's gone here digitalis. Okay, bete. And then chronic osteomyelitis is sequestrum. There is a dead bone that diagnosed chronic osteomyelitis. Dead is chronic osteomyelitis. And right, and when you remove this dead bone in chronic osteomyelitis, because dead bone है तो हटानी पड़ेगी. Dead bone कैसे रखोगे आप? It's called as bleeding sign, paprika sign. So chronic osteomyelitis, the whole bone is deformed, the shape is deformed, right? This is how it is. The dead bone is called as sequestrum. It's in the center, surrounded by a live bone called as involucrum. So in the center is sequestrum, surrounded by a live bone called as involucrum. And then you have draining sinuses called as cloacae. So this is chronic osteomyelitis. Diagnostic of chronic osteomyelitis is sequestrum. You remove the sequestrum, it's called as the bleeding of the paprika sign. And here you use a very important instrument called as a nibbler. Bone nibbler. All right, remember that. In any chronic osteomyelitis or acute osteomyelitis, the local area which is affected is usually lower end of femur. It is the lower end of femur which is usually affected in chronic osteomyelitis. Remember that. When you have chronic osteomyelitis, you will cover that area, right, with a good soft tissue. If you don't cover the bones with the soft tissue, they will die. So there is a procedure called as negative pressure wound therapy, also called as a vacuum assisted closure. VAC or vacuum assisted closure, which is there as a negative pressure wound therapy. All right. So remember this is very, very important. Sometimes in the bone, there is something called as a multifocal osteomyelitis involving multiple bones, which is seen in something called as a SAPHO syndrome more than sickle cell anemia. So SAPHO syndrome, anybody who can tell me the full form of SAPHO syndrome? Anybody who can tell me the full form of SAPHO syndrome? Synovitis. Acne. Pustulosis. Hyperostosis. Osteitis. Okay, so it's a misnomer. It's an HLA-B27 positive autoimmune condition. But अगर आपसे multifocal osteomyelitis पूछा जाए, SAPHO syndrome option है, you have to mark it. All right, this is what you have to mark it. Okay, going to next. Infections of the hand. The most common infection is the infection of the nail bed called as paronychia. Then you have infections of the pulse space of finger called as the phelon. It is the pulp space of finger. Right? And then the infections of the tendon sheath called as tenosynovitis. Remember, tenosynovitis, and you have cannibal signs in that, which means pain on stretch, uniform swelling, flexion of the finger, tenderness along the sheath, which is the most specific. Right? Remember one more thing, that the infections, right? That the infections of the thumb can go to the forearm space of Parona, can go to the little finger. So infections of the thumb can go to the little finger, but not the index finger, because index finger sheath is separate It is in the thenar space, which includes the index finger tendons and the first lumbrical. So remember that thumb के infection index finger में नहीं जाते, but little finger में जा सकते हैं. All right, so it can go to the little finger. Remember that. Okay, this is what you should remember. When you have infections of the subcutaneous tissue, that's called as mycetoma. It can have draining sinuses, painless swelling, and the colonies discharging from the sinuses, right? So remember that in an MRI, it's called the dot in the circle sign. So dot in the circle sign is seen in mycetoma. Why mycetoma is very important? Because orthopedics, the most common symptom is pain, but there are two conditions which are painless. One is mycetoma, second is Charcot's or neuropathic joints, which are seen in diabetes mellitus, the mid-foot joints, most commonly. So diabetes mellitus, the mid-foot joints. All right. So this is how the painless joints are seen. This is how Charcot joints are seen. Are we good? Some questions? Answer, please. Answer is chronic osteomyelitis. Next. Ring sequestrum is with the external fixator. Remember that. यही question आया sequestrum पे. Remember that. Next. Safer syndrome. Beautiful. Next. How will you prove it's an infection? Aspiration and grow the culture. Aspirate and grow by culture sensitivity. Correct. Next. टीबी नहीं होता बेटा, स्टेफोरिस होता है. ऑर्थो में कुछ भी आए समझ, तो ऑर्थोपेडिक्स का राजा है स्टेफाइलोकोकस. नेक्स्ट. Tuberculosis of the bone and joint starts from the lungs. All right. Okay, you want a break? So let's take a break. We will take a break for 10 minutes and come back because I think you had a continuous class with Zainab ma'am. Tarun, continuous class थी? हाँ? Zainab ma'am के साथ continuous class थी? Okay, we take a 10 minutes break and come back. Come back in 10 minutes. Okay, dinner break दे देंगे बाद में. अभी dinner break क्या करोगे भाई? So 6:23, we start at 6:35.
अरे ये बंद हो गया।